Thank you very much, Alistair, and good afternoon, everyone. Thank you for joining. So in the next sort of 20 minutes or so, I'm going to be talking through budget impact modelling, and it was great to kind of see an example of kind of the budget impact modelling outputs in Lucia's talk. I suppose I'm going to spend 70 minutes walking through exactly how you would get to those outputs, and specifically how the outputs can be used at a local level when it comes to reimbursement, specifically in the NHS. However, although I'm going to kind of specifically talk about the NHS, and I'll use kind of a lot of examples of AI and radiology, just because at Hardian, a lot of our work has been focused in radiology. However, the methods and processes that you would follow for kind of evaluations in other markets and in therapeutics and other diagnostics are just as applicable to all those other areas. So in terms of a further breakdown of what I'm going to discuss, I'm just going to have a quick definition of what health economics and outcomes research is, which is the kind of discipline that budget impact modelling or budget impact modelling assessment kind of falls within. I'll then discuss briefly kind of what the budget impact modelling is by definition, and its characteristics, and the kind of underlying mechanisms in terms of how we derive the budget impact, and then discuss through kind of the most kind of important bits, which is the steps you follow in order to conduct these kind of evaluations, and also the kinds of types of data that you is also required in order to conduct these form of analysis. And then finally talk a little bit about how it's, oh, sorry, I've just seen a question. Have you not?
Yeah, we're still on your title slide, Lucy. So budget impact modelling for local evaluation. Yep. We're now on the agenda side. Thank you.
You're now on the agenda side. Okay.
Yeah.
Bit of a lag then. Okay. Yes, and then finally we'll talk a bit about budget impact modelling specifically for kind of local reimbursement and evaluation. Have we moved to the next slide yet?
Yes.
Can we see it?
Thanks.
Yeah. Okay, brilliant. So just to begin with health economics and outcomes research, kind of is in what it says on the tin, is a combination of two disciplines, health economics and outcomes research. And I'll start by kind of discussing the outcomes research, because really without the outcomes research, it's not really possible to do any form of health economic assessment. And the outcomes research really focuses on quantifying the impact of a technology beyond like clinical effectiveness and safety. So once you have that initial data that demonstrates safety and effectiveness, so for instance, improvement in reporting accuracy when a clinician is equipped with AI when reviewing a chest x-ray, for example, what's the implications of that improved reporting accuracy in terms of kind of patient pathway and outcomes. And the outcomes research is particularly carried out in kind of two parts, and kind of prior to conducting any form of data analysis, you need to work out exactly what the key outcomes are, in terms of where is the largest benefit going to be recognized, and you kind of decide those outcomes through an evidence review, and also engaging with stakeholders, as Lucia kind of gave a brilliant example of in her talk. And then once you have those outcomes decided, it's really about kind of collecting the data to demonstrate the impact of the intervention within those outcomes versus a comparator. And then, as I said, with the outcomes research, can then kind of move forward to conducting the health economic analysis, which is kind of concerned with optimizing the efficient and equitable allocation of resources within healthcare systems. And then ultimately, this evidence as an entire package is aiming to support decision makers when it comes to deciding, where best to invest money within the healthcare system. So just very quickly, the budget impact model is purely kind of a financial model that's used to assess the affordability of adopting a new intervention, particularly from the perspective of the payer. And this can be at a national level, but within the NHS, it's more commonly used for reimbursement at the local level. And given that the budget impact model is typically purely focuses on the financial implications of adoption, we include kind of any outcomes that have kind of cash releasing benefits. It is possible to account for the non-cash releasing benefits, such as the capacity implications or staff time, particularly in the outcomes research process, if that's kind of decided that that's what payers are particularly looking for in terms of the value or their kind of area of greatest unmet need. And the time horizon that's typically taken for a budget impact model is 1 to 5 years, because this aligns with the financial planning of payers generally. And because of this relatively shorter time horizon, means that the model complexity is slightly lower versus other types of health economic analysis that can be done. And because of this, it means that the data requirements in terms of outcomes research tend to be slightly less demanding. So this is the kind of underlying mechanism of any kind of budget impact assessment. And what we begin by doing is defining the total population that could benefit from the intervention, then using kind of epidemiology data to refine that down to a target population. And then once you have your target population, so for instance, it could be that an AI is supporting the review of chest X-ray, but within that chest X-ray population, you've got many types of clinical findings that can be detected. But in the budget impact model, you would typically choose to focus on the population with the highest unmet needs. So for instance, it could be a lung cancer population. And once you have that target population, you then map out the kind of resource and clinical resource use pathway of those patients, assigning a cost to kind of each key node in that pathway. And once you've done that for your comparator, which is typically kind of standard of care, you would then kind of repeat that exercise again, only this time you assume that the new technology or the intervention under question is available. And then once you've derived the kind of cost of illness associated with that care pathway, you can then take the difference to then derive the budget impact model of the AI. So in terms of the kind of typical process or methods that are followed to produce this type of analysis, these kind of 5 key steps are kind of internationally recognized and kind of published by ISPOR, which is the International Society of Pharmacoeconomics and Outcomes Research, which really is kind of the founding institution of health economics and outcomes research. So you begin by conducting a literature review that could be targeted or systematic. And with that, you can then really refine what your population, your intervention kind of comparator and outcomes are going to be within the budget impact assessment, and also using kind of leveraging evaluations that have previously been published. You can determine exactly the appropriate form of analysis for the evaluation. And using the findings from the evidence review, you can then produce kind of a schematic, typically kind of decision tree format that really allows you to kind of characterize the economic decision problem, reflect clinical pathways and the key disease area characteristics that are important for quantifying the economic impact of the intervention. And then you move into a data gathering phase. This is probably the most important phase of the process and requires a lot of planning. We'll talk a bit I'll talk a bit more about that later on. But the first step is to really kind of engage with stakeholders to validate your assumptions that are being made in the model, and then to also move into a phase of collecting the data that's needed in order to kind of populate the framework that's been validated and conceptualized using the evidence review and stakeholder engagement. And with all the data available, you can then move into the kind of model draft phase. Typically, there are a range of kind of softwares that are used in order to do this, but typically it's Microsoft Excel. And then you move into a kind of results phase and validation, where you're kind of testing your base case results to kind of extreme parameter inputs, different scenarios, and also testing the strength of the results against any uncertainty that's introduced by the assumptions that are made in the modeling process. So this is an overview of the kind of PCOTS, or population intervention comparator outcome timing and settings framework, that we use in order to specify exactly what's going to be assessed in the budget impact evaluation. Just to note, this is like specifically for the budget impact model. It's not necessarily reflective of like the total benefit that technology could provide. It's really used just to exactly be clear the population and the outcomes that are going to be quantified in terms of the budget impact assessment that you're carrying out. I won't run. I'm just a bit conscious of time, so I won't run through the example. But I think these will be available for everyone to review afterwards. So I just want to talk briefly a little bit about the type of data that's required in order to do the budget impact modelling. And this is probably like one of the most important things. So in terms of estimating your target population within the budget impact model, this is typically like quite straightforward. You can use epidemiology studies or national database. So for instance, the other NHS England's digital hospital statistics, the clinical effectiveness studies. So, going back to the example earlier, like demonstrating improvement in reporting accuracy, for instance, these are the studies that are typically like quite widely available by now in terms of kind of demonstrating the effectiveness of AI. Unit costs, again, extracting these or having access to these is normally straightforward. There are lots of national reference databases for this. The biggest blocker really at the moment for conducting budget impact assessment really is the outcomes research, as I kind of mentioned at the very beginning. And so that's really collecting the data that quantifies the downstream impacts beyond clinical effectiveness. And there aren't many studies that kind of have been completed that do this for an AI intervention, but there is kind of reference to one there that's currently ongoing. That's about chest X-rays, particularly and improving lung cancer diagnosis. So once you have, collected the data, performed the results, performed the budget impact assessment, it's really important to demonstrate the robustness and accuracy of those results by testing the results against any kind of uncertainty that's introduced by assumptions that are made in the analysis. So the analysis is a simplification or simulation of kind of real world events, but we can't account for everything, so simple assumptions must be made. And we do that in the budget impact assessment by performing a deterministic sensitivity analysis, where we vary individual parameters kind of one by one to assess which of these is kind of having the most influence on the results. So just quickly to finish up, I'm going to talk a bit about why a budget impact modelling is really important for local evaluation within the NHS, and that's mainly because reimbursement for health tech currently occurs at the local level. You could receive a nice recommendation, however, the actual reimbursement is going to occur at the local level, and the budget impact models, the way in which they can be designed, so they can be kind of converted into an interactive tool that can be then used to tailor the inputs of the analysis to a specific payer. So obviously, different payers have different population sizes, different workforce capacities, and all of this needs to be accounted for when assessing potential budget impact of a new technology in that specific case. And this is kind of an example here of how that kind of interactive sales tool could look like. Again, just kind of reiterate, allowing for flexibility of any assumptions around data inputs to ensure that the analysis is kind of truly reflective of what a payer kind of may be experiencing, and the potential that the adoption of the new technology could have. The budget impact kind of assessments can then be kind of further strengthened by publishing them for peer review, and that really does add like a additional layer of validation to the methods and inputs that are assumed when it comes to kind of having conversations with payers at the local level. Now, I've really kind of talked a lot about the outcomes research and the importance of the data that's needed in order to conduct these assessments. However, that shouldn't put suppliers off doing budget impact assessment even before the outcomes data is available, because early economic modelling exists, and it's really important, I think, that early economic modelling is conducted specifically for the health tech industry at the moment, because it really allows for kind of a minimization of the kind of investment risk in clinical trials. And really what the early economic modelling does is that it performs a budget impact assessment as I've described. However, where the outcomes data is missing, we can use assumptions based on published literature or engagement with stakeholders to provide initial estimates, to then provide an initial budget impact estimate, which can inform kind of go, no go decisions in terms of launching AI in a certain therapy area, but also it allows for kind of a clear oversight on what is going to be driving the value of adoption, and where is the data most needed to be collected, because kind of often in the past with some projects we've had AI developers go and collect data before kind of carrying out any initial budget impact assessment, and then we've done a budget impact assessment to actually realize that we needed data to just be collected in other areas where kind of the economic value was economic value case was being demonstrated more than the areas where they'd already collected data. So quickly, just to summarize, the budget impact model is a financial model quantifying the affordability of an intervention from a local payer perspective, typically. A lot of evidence review and stakeholder engagement is needed in order to determine the specific outcomes and of where an new intervention could be releasing the most potential. The outcomes research is a big part of that. However, the early budget impact model approach can be used in order to optimize the outcomes research process to determine exactly which data should be collected. And then finally, the budget impact models can also be used as a tool to support sales efforts. That's everything from me. Thank you for listening, and happy to take any questions.